Suti, the Council General, the Council of the Information, Social and Cultural Affairs, who co-organizes this event. Last but not least, I'd like to thank Bapak Bernard Lucy, who is a PhD student at the Jackson School of International Studies at the University of Washington, who co-organizes and moderates this talk. Now I would like to ask the Acting Consul General, Bapak Nugroho Aribimo, to give the opening remark. Silakan, Bapak.
Okay, can you hear my voice?
Yes.
Yes, okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon you, and God mercy and blessing you. Salam sejahtera, good morning in Indonesia, and good evening in United States. Professor Dr. Muhammad Ali from University of California, Riverside, Mr. Bernard Lucy, PhD candidate of University of Washington, the moderator, honorable participant of the webinar Religious Response to the COVID-19 Crisis in Indonesia, ladies and gentlemen. I sincerely hope that we are in a good health, and even though this COVID-19 pandemic has not over yet, but we hope that we are always in a good spirit and confidence to tackle this challenging situation together. First of all, I would like to convey our highest appreciation to the Department of Asian Language and Literature and Southeast Asia Center of the University of Washington for the collaboration with the Consulate General of the Republic of Indonesia to convene this webinar. It is timely for us to share with our friends, maybe in USA and also maybe in Indonesia, about the recent situation of COVID-19 in Indonesia, including on challenges that people in other countries might know about the situation in our country, Indonesia. Therefore, I'm delighted to present Professor Muhammad Ali, one of the Indonesian prominent Muslim scholar in US, who will give presentation on religious response to the COVID-19 crisis in Indonesia. Thank you, Professor Ali, for your willingness to be the speaker of our webinar, and also Mr. Bernard Lucy as the moderator. Honorable participants, ladies and gentlemen, according to WHO, as of October 25th, there have been 4.2 million confirmed cases in Indonesia of COVID, with 4.1 million people has been recovered. And Indonesia has reached the 150 million mark in COVID-19 vaccine shot administered, and Indonesia become among the top 10 countries for having the highest COVID-19 vaccination rate in the world. Indonesia, with 270 million people, has set a target to vaccinate 208.3 million, or everyone aged above 12 with no underlying medical condition. And according to the Indonesian COVID-19 Task Force, as of October 25th, a total of 113.4 million people, or 54% of people, has been first dose vaccinated, and 68.3 million, or 33%, has been fully vaccinated or has got second doses. In this effort, Indonesian government involves all parties in Indonesia, especially the police and military force, provincial and regency government, state-owned enterprise, private sector, as well as religious leaders, to join effort to further accelerate vaccination rate. Honorable participants, ladies and gentlemen, Indonesia is the largest Islamic population in the world, but Indonesia is a multi-faith country, and the government officially recognizes 6 religions, which are Islam, Protestantism, Catholicism, Buddhism, Hinduism, and Confucianism. And during the pandemic of COVID, religion-based communities have crucial roles to play in addressing challenges. And this topic will be presented by Professor Muhammad Ali in this webinar. I hope that you can get more information about these challenges in Indonesia through this webinar. I thank you very much.
Thank you very much, Pak Nugroho, for your kind and enlightening remark. Now I would like to invite Pak Bernard Lucy to moderate the event. Thank you.
Oh yeah, sure. Thank you, Ibu Pauli and Acting Consul General Pak Nugroho for the warm remarks. I also thank everyone who is virtually here with us. My name is Bernard, or you can call me Ben, and I'm assigned to lead the discussion this evening. I have to say that we are quite fortunate to have Dr. Muhammad Ali as our speaker, where he will be talking about religious responses to the COVID-19 crisis in Indonesia. The speaker will slightly discuss on global religious responses, not only Indonesia, before explaining how the two largest Islamic organizations in the world, Nahdlatul Ulama or NU and Muhammadiyah, address the global pandemic. For those who are not very familiar with Indonesia, I must add that these two institutions are really influential non-state actors in Indonesia. What I mean is decision makers in Indonesia almost always take into account Muhammadiyah and Nahdlatul Ulama's views before formulating state policies. I hope it can give better picture how these two institutions are quite impactful in Indonesia. Now let me introduce you to our speaker. Dr. Muhammad Ali is Associate Professor of Islamic Studies at Religious Studies Department at the UC Riverside. Dr. Ali is currently the Director of the Middle East and Islamic Studies Program, a position that he has held since 2016. He received his PhD in History Southeast Asia with minor fields World, Europe, and Middle East at University of Hawaii at Manoa, Hawaii. And he got his Master of Science in Islam and Politics, Islamic and Middle Eastern Studies at Edinburgh University, Scotland, Great Britain. And he got his BA in Islamic Studies at the State Islamic University of Syarif Hidayatullah in Jakarta, Indonesia. Dr. Ali wrote 3 books so far, and then the latest is Islam and Colonialism, Becoming Modern in Indonesia and Malaya, published by the Edinburgh University Press in 2016. In addition to the 3 books, Dr. Muhammad Ali has published more than 20 journal articles and book chapters. He has taught some courses like Modern Islam, Southeast Asia Religions, Islam in Southeast Asia, Islam in America, Peace in the Middle East, and some other courses. Now, before I invite our speaker to deliver his materials for about 30 minutes, I would like to welcome anyone who wants to raise questions or comments to put them in the chat. And I will read your questions during the Q&A session. Or you can also raise hands if you like. Now, without further ado, Pak Muhammad Ali, you have the time.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and good evening, good morning in Indonesia, good evening in the US. It is my honor to be part of this event. I would like to thank Bapak Nugroho Aribimo, who already opened an introduction about the COVID-19 situation and the vaccines in Indonesia. And I would like to also thank Ibu Dr. Pauli Sanjaya from University of Washington, Ibu Rina Stuti from the Consulate also, KJRI San Francisco. And I would like to also thank our moderator, Bernard Lucy. Thank you so much. It is my honor to discuss these very important and timely questions on how religious communities, response to the COVID-19 pandemic in Indonesia. This topic is, a very important for us to understand in order to understand not only Indonesia as one of the largest democracies in the world, but also the question of religion, faith, spirituality. When we talk about health problems like the crisis of the COVID-19. So what is the place of religion? And of course, we can approach this question of religion and COVID-19 from different angles, from different approaches, according to our own disciplines and angles and perspectives. Here, I just want to give some highlights on some of the key things that we can learn from religious community responses to the COVID-19 in Indonesia. We might also want to think about how religious communities and leaders also play their role in the US or in any place around the world. I believe that you can see my slide now. Can someone say that you can see my slide?
Yes, we can.
All right, thank you. So when we talk about religions, the perception is that religion has a negative role in the spread of COVID-19. In fact, religious gatherings, some of the religious gatherings might also contribute to the spread of COVID-19 in some places, in some of the moments in last year and also this year. So among Muslim, organizations quite famous at that time, Jamaat Tabligh, for example, coming from India, they had a huge gathering. Then there was a media, coverage about that, and then there was a concern about this same organization having large social religious gatherings also in Indonesia, in Makassar at the time, or in South Sulawesi, even though it was canceled because of the rejections and condemnations by many people about this. And also you have in other contexts among Catholic churches, for example, or other religious communities who are insistent about having their religious gatherings during the COVID-19 outbreak. So you have this perception, quite negative perception about the role of religions at least in media, right? So, because religions are about community, about meeting peoples, about shaking, about hugging, about meeting, and so on and so forth. So there is some concern about this. But this perception might not necessarily do justice to what's going on, around the world, including Indonesia, because religions have participated in the mitigation, in addressing the crisis, and also part of the solution to, for example, the vaccination and social protocols, health protocols, and so on and so forth. We will talk more about that. So in the world, the COVID-19 pandemic presents challenges in profound and still evolving ways, at least until today. So it's been quite some months and 2 years now, with high death tolls and extreme economic and social impacts worldwide. It raises questions about how religious institutions, beliefs, leaders, and practices are contributing positively and less positively, the one that I already mentioned earlier, to the ongoing coronavirus crisis and response. Religious actors have large roles to play, particularly in addressing challenges centered on safe religious gatherings, adaptations of ritual, worship, adaptations of these forms of worship. Also, religious actors play some roles in building trust between communities and leaders, the clergy, religious authority, or ulama, or pastors, rabbis, and so on. Right? So religious actors also play a role in building trust, but also building trust between religious communities and the government, policy makers. Also building trust between religious communities and health experts, right? Those who are an expert in the pandemic. So the trust, the building of trust, also something that religious actors have played. Then they also play a role in promoting effective communication and advocacy. So effective communication, again, between the peoples, the congregations and the leaders, and between the congregation and the leaders, political leaders, but also health institutions, and advocacy, for example, about keeping health protocols and vaccination and so on. And religious actors also play their roles in identifying and responding to the needs of the communities, because they are at the forefront of the communities, right? Religious leaders are with communities, so they are the one who are every day meeting with people. So whatever they say and do and act might also contribute to the way people react and act and also follow. So they would listen, and then they could also address the needs of their communities in different places. Then they are also critically involved in countering hate speech. So you have, in social media, but also in different events, hate speech against, politicians, or against religious leaders, hate speech against peoples who they don't agree with. For example, there's so much going on, and also misinformation about COVID-19, and also about vaccines, about all kind of information and misinformation. They also play a role in addressing conflicts between different religious denominations, or conflicts are related to certain issues. So the religious leaders play a role in this. In this rapidly evolving situation, religious voices should be part of the broad policy exchange. So the government policy should also involve religious institutions based on an informed and nuanced understanding of the development. So we already know about this COVID impacts on religions in many different ways. All religions have been impacted: world religions, national religions, also indigenous religions, indigenous beliefs, and they also have been impacted by this COVID-19. So it's very pervasive the way this COVID-19 has. Then you have also some significant changes on some of the practices of these religions, right? Just different example here. So the Hajj pilgrimage to Mecca was canceled, for example, 2020, and it's very restricted in 2021. And of course, you have Catholic masses have canceled. All these rituals involving peoples were canceled, especially in 2000 last year, and then there was some changes later on this year when it is considered safer to conduct a limited or restricted number of people doing worship together. So there have been also significant changes. So some of the challenges that religions in general have faced are: what is the relationship between science and religion? Because the virus is about science, it's about pandemic, virus and pandemic, and then religion, faith. What is the relationship between this science and religion? Are they compatible? Are they contradictory? Are they intersecting? So there's some tension, but also people who are seeing no contradiction at all between being scientific, following science, and also being faithful to one's religion. So the notion of disease: what is this? What is the source of disease? Why would someone be sick, ill? Is it because of something here in this world, or because God wants you to be sick for health? or healthy, something that God wants you to be, or but is it something that you yourself do? So the relationship between human free will and determination or God's intervention. So that's this thing. Also vaccination, drugs, that could vaccine and drug are different thing, but in the religious perspective, it is about whether or not humans need to produce and use vaccines in order to prevent someone from being sick or infected with the virus. Then you also have something about protocols and different levels of compliance among religious communities in Indonesia, but also in different parts of the world. The second challenge is about the relationship between government, either religious governments or not necessarily religious government, and the society at large, which is very, very diverse. So how to coordinate, how to build trust, how to be consistent, for example, how to be patient. So that's all thing that I think that some of the challenges faced by religious institutions. This is a slide about Muslims addressing pandemic in the past. So I'm not going into detail, but I just want to say that this is not the first time that Muslim communities and also religious communities, Christian communities and others actually had this situation of the pandemic, not coronavirus, not COVID-19, but flu pandemic, Black Death, for example, in the medieval time and so on. So there's already in history, but how they responded religiously or scientifically. In Indonesia, religion-based communities and actors, again, as I mentioned, they are very important in mitigating the crisis and addressing the impacts in the communities. So one first question is theology. What is this that pandemic happening? So is it a divine punishment? Is it a test? Is it an act of nature that nothing can actually change? So is it divine punishment, a test to peoples about their spirituality, about their belief in God, about their trust in God, about their care to the people, and so on? So there's these theological questions raised because of this COVID-19. Where is God in this pandemic? Why there's so many people dying and sick because of this? So they start to think about their fate. Why do we lose our loved one due to the virus? Can we avoid being sick and dying, right? So you have this theological, reflections and interpretations, and this some of the books or opinions produced by some of Muslim scholars like Muhammad Shihab, that the coronavirus is a test from God, so that they can can be a better person. So it is a test for people to be better human being, to be a better person. It's a test. It's not a punishment, according to one of the Muslim scholars in Indonesia. But again, this is one of the interpretation. There's some people who believe that this is a punishment for they misbehave or sins and so on and so forth. So you have a variation of theological thinking about why the virus is coming and affecting peoples. So one of the organizations in Indonesia is Islamic Modern, we call modernist organization, because they are basically mostly in the urban areas. They have this Muhammadiyah COVID-19 command center right away after the government declared COVID-19 pandemic 2020. They already established this Muhammadiyah command center, COVID-19 command center. So basically they coordinated, they produce guidelines, they work to prevent more outbreaks, to follow the health protocols, to adjust some of the rituals, and also because they have schools and universities, how to study from home, and how to also do hybrid schooling and so on and so forth. So they do all kinds of stuff, including scholarship, giving some foods to the people who are in need, and women also play a very important role in this, and so on and so forth. So this is just an example. And then more hospitals that they have, about 86 hospitals associated with this institution, organizations play in this, COVID-19 mitigations, and they become very important places for people to turn to. So you have hospitals produced by religious organizations in Indonesia. Then you have other things that they do. They distribute masks, hand sanitizers, they distribute ventilators, other medical equipments. They also do disinfectants, distributing food, I mentioned, and also give some advice, religious advice to people who are in need about what to do religiously. And of course, they promote the idea of clean and healthy life movement. So this is just some, some pictures how they work for the community, from the community. They are non-governmental organizations, but of course they work with the governments and international institutions. So, so this is just a picture of you to see how they are very active in responding to the crisis. Of course, there are so many HOAX and social media misinformations about COVID-19. All kind of conspiracy theories, for example. And then the leaders say that this is not a conspiracy, this is real, this is scientific, that everybody should play a part in making sure that they are not infected. So this is one of the ways that religious communities try to do. And ritually speaking, what to do with the ritual, right? We had a fasting month, for example. People would gather in the mosque, right? But they had to do it at home now. So praying from at home or from home, for example. And also one of the Islamic festivals that they had to cancel, in terms of the public event. So they did it more as a family religious festival. So they did it in a home, for example. And then they also issued some fatwas. Fatwa is religious opinions about many questions related to how to be ritually correct while they are under the pandemics. And one of the things that they are inventing is the virtual Friday congregation. So you have a weekly sermon and also prayer. Instead of in person, they do it virtually. Of course, there's some controversies around that, but this is one of the things that they need to adjust, like Friday prayer. And educationally, because these religious institutions or organizations have schools. Muhammadiyah, has thousand schools, and also universities. They have to adjust educationally as a religious institution and also educational institutions. So how to do an online learning, right? They have to be very creative in making sure that the students can still get education while they are at home, for example. The notion of hybrid learning, when things they looked a little better, and they did hybrid learning. And then they opened school September 2021, so it was just recently, but still very restricted and in many ways. So educationally, even if they're about religion, education is the key. And organizationally, they postpone one of the events, 4 or 5 yearly events, National Congress. They had to postpone it, they had to cancel it and then postpone it maybe this year or next year. And then they first mass mandate on meetings and restrictions, and of course the application to detect a surge of COVID patients. So they had app in the smartphone about how to detect COVID patients. So they can go to a right place or right hospital if they have still bed, for example, around in the hospitals. Vaccination, religious institutions play a role in making sure that people get vaccinated. There are some reservations and rejections among people about vaccination. There are kind of hoax and conspiracy theories, and it is forbidden, in material, for example, in the vaccine, all kind of misinformation about vaccination. They have to make sure that people trust the government, also the health experts. So vaccination are safe and effective. They say this is according to the fatwa. And then they also do some guidance about vaccination. They have vaccination sites. So the hospitals and also universities, branches, they are open for vaccination sites. So religious institutions and spaces also are used for people's getting vaccinated. And they are not necessarily Muslims, everyone, without regard of their religions. Of course, they collaborate with other peoples in in providing shelters, for example, for Muslim and non-Muslims in Indonesia. So you also have, collaboration between Muslim, Catholic, Protestants, Hindu, Buddhists, and so on in Indonesia. Of course, the government plays a role, and the Ministry of Health and state-owned enterprises, Ministry of Social Affairs, Ministry of Religious Affairs, they collaborate. Of course, they're also very critical of some of the government officials in some of the inconsistencies in the policies, for example. They are also very critical of certain things by the government, but they are basically very, supportive of the government. And then, of course, collaborating with international agencies. US aid, for example, there's one of the organizations. They collaborate with Singapore and other international institutions. The second organization, but this is the biggest one in terms of the populations and numbers, is Nahdlatul Ulama. They also have Satgas COVID, Satuan Tugas COVID, task force of the COVID-19. So they basically pesantren, thousand Islamic boarding schools in Indonesia. So they also become part of this mitigations and response to the COVID-19. They also have to issue fatwa to make sure that the religious leaders across Indonesia would trust the government, would trust their leaders. They also give some financial aids and also vaccination. So I'm just giving you this very general and some of the pictures, leaders with religious communities, and also all the peoples who are in the vanguard of this vaccination. So you see here, they also give some funds to people's food and other things. Christianity also, of course, is part of a solution, or they also responded in many different ways in terms of how to mitigate the COVID-19 impacts. And Hindu responses to COVID-19 in Bali, particularly, the notion of Sakala and Niskala. Sakala means the seen, and Niskala is the unseen. So the two ways that they respond to the COVID-19, physical and spiritual, right? Physical and spiritual ways to cope with the COVID-19. And yoga and meditation is one of the ways that some Hindu scholars and clergy also introduce and also promote to people, especially in addressing some mental problems or mental health, to maintain mental health and well-being. So yoga is things that becomes quite important in this way. Indigenous communities, religious, indigenous communities also play a very important role. 100 of religious communities, they are indigenous, also play a role in addressing the impact, and also the vaccination for people. They call the masyarakat adat, local custom community, or the community who are indigenous to Indonesia. Of course, religions are the institutions that give them hopes and optimisms. Prayer is a very important part of this. In their communities, interfaith prayers also have been conducted in many different ways, virtually also, and then of course collaboration. And what's next is we will see, but more collaboration between Islamic organizations, and also between faith-based communities, between faith communities and the government, and also religious communities, government, and international institutions, because COVID-19 has no religion. But the religion should respond to it. Thank you so much. I hope that I didn't go over the time. I didn't see. Anyway, Thank you so much, and I look forward to our conversation. Let me stop sharing.
Thank you, Dr. Ali. Very informative and quite comprehensive in seeing how religious institutions in Indonesia offer their response in this pandemic. Um, while you were presenting, I was wondering about some things while I'm observing what has happened here in the US, and then after learning what you have presented, there has been different responses in the society in looking at COVID-19 and how the vaccine can possibly solve this global problem. Some have positive response, but unfortunately and understandably, there are also some resistances in the society, both here in the US and in Indonesia. And I am wondering how you can compare the rejection narratives in Indonesia and the US, and what are the roles of the religious organizations in both countries to address the people's skepticism about or on COVID vaccine.
This is really a great question. It's a great question. Thank you. You know, we can talk about this in from different angles, but generally speaking, as we know, as we've been here living in the U.S. and also we observe, and I stay in Indonesia for 2 months during the COVID-19, and I felt how we lost relatives, friends, and so on and so forth. Here also in the US, people have to address this loss, right? There are so many losses. So I think one of the things that I see and observe in Indonesia and the United States, when they see themselves, the impact around the COVID-19, when they got infected themselves, or when their families or friends or someone that they know get infected, that also play a role in the way in which they actually would accept that we need to do something. And then the level of skepticism, the level of resistance becomes lower because of that. So they just need to see, observe themselves and feel. And I see that changes in Indonesia and in the United States. So before, they just see it from the media, right? When they just listen to the media and they don't trust, especially along political lines, unfortunately, right? Either they are for or against the government, for example. That also play a role in whether or not they would accept the vaccines, So, but when they see around them and themselves, that's one thing I see. So they need to see and feel in order to, less their skepticism. That's one thing. Number two, I think the governments play also a very important role, and sometimes inconsistencies on the part of the government also make them resist, the policies, certain policies, right? They say, why, for example, would I restrict my religious congregations? Why they see that the governments or, government leaders, politicians they are not following the protocols, for example, right? So they see, when they see that also make them even resist that. I don't trust you because why would I follow that if, for example, malls are open, for example, right? Why would my, religious worship, which is according to them more important than just going to the mall, for example, was restricted, right? So that's number two. So I see that, inconsistencies in certain, apparatus, not all of them, that make also. Number three, I think the rule of theology, the rule of the belief. They believe that God, interferes in all affairs. When they believe that God interferes in all affairs, being healthy, being sick, even dying or death, then they would, less likely to accept certain things like vaccination. So in other words, they believe that, God will decide. It's not the vaccine. So this theological perception or interpretation also play a role in Indonesia and also in the United States. And we see that. And number four, of course, there's some hoaxes and misinformation about vaccine itself. They say that vaccine is actually a way of interfering your privacy. There is a chip in the vaccine, for example, inserted. So you will be basically losing your privacy and so on. And so this misinformation also play a role through social media, and I see how this is also play a role. And then religious communities and leaders play a role in correcting this misinformation, right? That's not true. Vaccine is safe and effective and so on. So there's 4 things that I can see how we can see the similarities and differences. But that's really, we can talk more about this, but that's one wonderful question. Thank you, Bernard Lucy.
Yeah, we have a question from Dan. He's asking, the context is in Aceh, the only corner of Indonesia where Sharia law is officially practiced. How is Aceh doing in terms of vaccine promotion, distribution, and or misinformation?
Wow, thank you. I visited Aceh a few years back before the COVID-19. I just see the news about this, so if I cannot tell really what's happening on the ground, but this is a fascinating question, and there's so much research about Aceh. But generally speaking, of course, Aceh is not so different from the rest of the provinces, even though they are ritually speaking considered more conservative, for example, because of the history of Islamization. But doesn't mean that they are, less accepting or more resistant towards, let's say, vaccination. So my observation from afar is, I think there is no significant difference in terms of how they are doing in the crisis, and also how they address it through vaccination. So in other words, the rate of vaccination is still quite high in Aceh. They still, they trust the religious leaders, because religious leaders there also play a role in, conveying the message that vaccination is safe and effective. So I'm not sure if there's any significant difference in Aceh compared, for example, to Papua or let's say Central Java or Kalimantan and so on. But I should look into this more to be more precise in my response to you, because it's very specific about Aceh. But I know that some of the Acehnese friends, they are doing fine. I mean, I see them, they are also doing the vaccination. They are, doing all kind of things that I already explained. You have Nahdlatul Ulama organization, you have Muhammadiyah there. You also have local, institutions, NGOs, and also the government. And also they are very international oriented. They also are very, up to date into what's going on around the world. And they also collaborate with international institutions, apart from their collaboration with the national institution, national government in Jakarta. So I don't have a very specific answer to this question, but that's make me maybe read more about this. But thank you for the question. That's what I can say from now. Thank you for the question.
All right, thank you. Yeah, I see 2 raised hands. I'll invite Imelda Hussein and Ibu Fatima Hussein after Ibu Imelda. Go ahead, Ibu Imelda.
Thank you. That was such a great presentation. So I'm actually Indonesian, and I'm a half Acehnese. So I know, So some people and some of my family in Aceh, well, actually COVID-19 in Aceh is not really like a big thing, because some places even safe. Like it's like kind of like the safest place in Indonesia. I can say that. Barely like some people got a COVID or something like that in Aceh. I don't know why it happened, but it actually happened. Well, actually, I'm originally from Bandung, but I have some family in Aceh. And also, I have a question about the mosque and the mall and stuff like that,
Mhm.
because when it was like the Eid al-Fitri, I was still in Indonesia back then. And then I saw that a lot of mall, they're open, big discount, and then people just came to the mall. They're so crazy about the discount and shopping like that. While actually during the Salat Eid al-Fitri, like you're not even allowed to do it or perform the Salat in, like the usual place, like before, like previous year. And that was pretty weird. Like they closed the mosque, they closed the activity about the religious and stuff, but about the new clothes and stuff during Eid al-Fitr, it's fine. Like, what is wrong with the government? Like, what is your point of view to that?
Mhm.
Yeah, that's my question. Thank you.
Thank you. Shall I respond directly now or wait for another? I can respond right away. But
Yeah, you can respond right away.
okay, thank you. That's a really good question. Thank you, Imelda, for sharing your insight about Aceh. That is, not as, for example, the outbreak is not as big in other provinces. But we should look into the statistics and how the rate of infections and also the vaccination. That's a good point. About mosques and malls. Yeah, this is one of the issues that some Muslims and peoples, not only Muslims, non-Muslims, who feel that why the government is very strict in terms of controlling religious gatherings or religious communities activities, and much more than, for example, businesses like malls and others. That's one of the concerns among some of the religious peoples in social media everywhere. They talk about that. But I think it's not either or. My response to this question is it's not either or. The question is not about religion or non-religion. It's not about it is religious activity, it is economic activity. The question is about gathering. The question is about that distancing, social distancing, physical distancing. That and that's what has to be, emphasized. So, in other words, the government and the people should tell people, other peoples, that it's not about prohibiting you from worshiping or from doing some economic activities, but it's about the distancing, because the virus spreads through closeness. So the notion, this is it is about science. It is about something real. And it is just a matter of whether or not you, as either religious or a businessman, address this. And so it's not either or. It's if it's not either or, I say. So in other words, you have to restrict gathering in the malls as well as in religious institutions. There is no privilege. When we talk about religious freedom, right? In the U.S., in America, many religious peoples who resist restrictions, they talk on behalf of, in the name of religious freedom, right? This is my freedom to worship God in my ways, right? Yes, but your freedom might impact other people's freedoms. If you are, for example, infected and you are not aware of it, and then you meet with people and the other people were infected because of you, then your freedom actually cause harm to other people. So it is, I don't buy the religious freedom excuse when they talk about this, and that should also happen, and also happen not only religious communities but also economic activities like malls and others. So it's not either or. It's about gathering. You have to restrict gathering. You have to restrict this crowds, and you have to clean up your your hands and so on. So all these things are universal, and this universality of the disease, the virus, and the vaccination should be emphasized across religious boundaries. even across national boundaries. And I like this question, and this is something that need more research, but that's my response to Imelda Hussein. Thank you, Imelda.
Thank you.
All right, so there's no absolute freedom. Okay, so let's go to my spiritual advisor, Ibu Fatimah Hussein.
Oh, please.
Thank you very much, Mas Ben and Mas Ali. It has been years since we last seen each other. Thank you very much also for the thorough presentations. I enjoyed very much, and it gives me some new information, especially on the role of Muslim organizations and religious leaders who are also take part in the in helping non-Muslims. Yeah, so it's really useful information. I value your presentation on looking at the positive contributions, bringing the positive vibes, during this pandemic. But I wonder if you also see, like some also negative roles that religious communities play, certain religious communities towards other religious communities play during this pandemic. I wrote a very short book chapter on the book written in Bahasa Indonesia, Virus Manusia dan Tuhan, which was published by ICRS, in which I pictured one village in Jogja, in Sleman, Yogyakarta, in which they specifically target, in this case, Muslim communities in giving charities. So, and it is specifically directed and allocated for Muslims only. So it even targeted Muslims who are more well off instead of non-Muslims who are less well off. So I wonder if you also see this also, like a negative roles that the pandemic bring, and in a way also strengthen religious segregation in the community. You can probably give an example whether it is here in Indonesia or in the US. Thank you, Mas Ali.
Wow. Professor Fatimah Hussein, thank you. It's good to see you here. Of course, please share more, more work on this. And I think we need more ethnographic research about this, like really field work, right? Grounded research about how, religion on the ground plays diverse roles. There's no one rules. I emphasize the positive roles because I see the negative role already in the news, in the media about the place of religion in terms of religious gatherings, right? The news about, Jamaah Tabligh, for example, in the, and that's really the main thing as my background. So that's why I try to highlight some of the things that positively religious layers actually do in terms of the COVID-19. So the negative rule that you mentioned is there's always ways people using certain things. There are always ways people use religion for their own benefits, for their own exclusive, sometimes sectarian, and even not positive intentions toward other religious communities, or either other non-Muslims or other Muslims organization. They are not in the same religious interpretations or observations. So you do have some tension between Muslim organization and also between Muslims and other religious communities. You have, but I think this should be more grounded on research. And I like that you mentioned about that instance of of this charity, right? They collect charity and then they just use the charity for their own groups, and then that's one thing. But there's always bad people, there are always bad intention, even among the so-called religious peoples. But I think we just need to be more precise about this. What institutions, maybe not necessarily institutions, maybe who are these peoples, individuals who are doing this? Are they doing this in the name of their organizations or on their behalf, or as individuals, right? In Indonesia, we call them oknum. So there are some oknums as well, so individuals who are misusing this crisis for their own gains, right? I just don't know exactly what are they, and you already mentioned about one of them, and I think I cannot tell more about this. I just need to do more research about this. And interestingly, journal articles now, books are being produced and published about these topics. So I really hope that Professor Fatima Hussein would also contribute more about this aspect of the diversity and variation of responses on the ground. I just want to echo that. So I don't have any specific response to that. And in America, of course, in America, the same thing's happening. So there are more research. I read more and more articles now about this, including the church, the Catholic Church that is still doing the ritual, the mass under the pandemic, and there are some outbreaks out of because of that. So again, usually the negative rule of the religion is about religious gatherings. That's the most common thing. But other dimensions, other aspects, I think need to be explored. And I agree with you. And I just need more to talk about this. Thank you. It's wonderful.
Thank you, Ma'am.
Wow, awesome. And I have a question here. What works and what doesn't work in terms of mitigating vaccine hesitation from various religious perspectives in Indonesia?
Wow. This is like another session. Wow. This is a great question. So what works and what doesn't work, right? Wow, this is an amazing question. What works is authority, religious authority. So in the US, if you read some recent statistics or surveys, yeah. So those people who come to the churches would more likely listen to their clergy, and meaning religious authority, right? Clergy is religious authority. They would listen to them. They see the positive aspect of it. So in other words, religious authority plays a positive role in mitigating, for example, restrictions, following health protocols, right? Correcting the misinformation about COVID-19 itself, about the vaccines, right? So religious clergy or authority in general, in different religious communities work. So religious authority. So people still listen to the religious leaders and clergy in Indonesia as well as in the United States, because religions in general are still very communal. What doesn't work is that when people tend to be more individual in their spirituality, they are not necessarily bound to certain religious institutions or establishments or authorities. Then they would use they just see the media or the internet. If they are smart enough, if they are intelligent enough, or they just common enough, then they would just follow their conscience, right? They would follow conscience, and then they would do the work. They help the people. They try, to get vaccinated and so on, right? If they have this common conscience. But if they just follower of all this information and misinformation, this is not working. So in other words, they become more individualized at the same time, and it depends on whether or not they are using their conscience about the cause of the COVID-19 and also the possible mitigations. That's number one. what works and what doesn't work. Number two, sometimes religious justifications do not work, just because these religious justification are issued by other than their own religious orientation. So in other words, religion is divisive in this case. When they see that this is about religion, it is about the understanding of God in certain ways, then what doesn't work is religious justification is simply making things complex, make complicated the responses so among the peoples on the ground, the religious communities or the ordinary people. What else that I think, that's number two, right? So I think that's what works and what doesn't work. Because what I see is that collaboration. So sometimes it is very difficult. Is it religious or it is actually religious and secular, and it is very difficult to distinguish what is religious and what is not religious when we see these responses. And even though they don't necessarily claim that they are religious, but they are working with other peoples, with religious peoples, and they're also spiritually very devout, and they are caring and they are helping other people. So that's another thing. It's sometimes very hard to see where is religion. I should have more to say about this, but that's all from now. But thank you so much for the question. What works and what doesn't work? More questions?
Yeah, I think, yeah, we have a raised hand. Dimas Ramadan.
Please.
Thank you so much, Pak Bernard, and wow, Pak Ali, thank you so much. I always love your presentation. So this is a very interesting topic, and since we're also discussing about vaccination and religious response in vaccination, it's something comes to my mind actually. So we have been seeing a lot of fatwa issued by religious authorities, like saying that due to the emergency situation, so vaccine is allowed. So consuming pork contaminated vaccine is okay. So the problem is, if we take a look at the history, the history of vaccination in Indonesia, for example, we've been using emergency situation fatwa many times since 2002, for example, for polio, and also for meningitis in 2010. So my question is, because you're a historian, is it always like that? Is it always religious authorities give like a permission by using emergency situation to allow something that actually textually has been prohibited? That's the first. And the second, how long can we use emergency situation as the reason to allow such thing? So this question is, I believe, is significant because Muslim acceptance of vaccine is always the lowest in the world. So thank you so much for the time and for the answer.
Thank you so much. This is another great question. Thank you for having this event. I wish that we have more time and more, research about this. And again, Dimas, thank you. The first question is, has there been any case before in the past that Muslim religious leaders would use emergency clause or emergency pretext for allowing the forbidden materials, for example, in things like vaccination or drugs in general? Yeah, I don't have the answer, exact answer. I don't pretend that I know the answer for this, especially in history. But we know that emergency or darurah Yeah. So darurah, the question about darurah or darurat in Indonesian word has always been used in usul fiqh, right? In the principles of fiqh. In many other cases, in cases, like different things, like when you are starving and you don't have anything else, you can eat pork, for example, in the case of that meat that is considered haram or prohibited in Islamic law. But in terms of drugs or specifically, I would say, especially for vaccine, I don't have any information, but drugs, yes. So we can, maybe we need to know more about the history of Islamic law in terms of darurah. The uses of darurah, right? The uses of darurah or emergency situation in Islamic law and jurisprudences. So I don't have any specific answer to this particular question, but I believe yes. I just have to look for more information about that specific questions. But the question number 2 is more interesting in terms of what is the limit, right, to emergency when it's, but it depends. So there is no time limit. So scholars just, it depends on emergency itself. So there is no time limit, like 1 month, 1 year, or even maybe 5 years. Emergency could happen, and it depends on the cause. So if we say illah is the cause, make things emergency, then when the illah is still there, when the cause is still there, then it is still emergency. When the illah is removed, or then you don't have any more emergency. Let's say now still COVID-19 is still around, right? So the illah is still there, not to have, for example, a prayer together, jama'ah, congregation, until the COVID-19 is gone, or most people are vaccinated. Then they are allowed to go back to the normal situation. So I don't see time is something that restrict emergency. There is no specific thing about that, but I think the illah is to make it something emergency. When the illah is out, removed, gone, then the emergency is gone. It becomes normal again, right? So there is no limit to that. That's for the second question. That's when we talk about usul fiqh, principle of Islamic law. The first question, Dimas, I should read more about that. But thank you so much for the question.
Thank you so much, Pak Ali. You just answered one of my dissertation question.
So it is great that you are doing this work, Dimas. I really wish your best, on this work, and it is very important question. So if you can find resources in Arabic about about the uses of darurah, in terms of allowing or permitting certain things that are forbidden, otherwise forbidden, like. I think that would be wonderful information for us. So I'm looking forward to your research finding on that particular question.
Thank you so much, Pak Ali.
Yeah, it happens that Dimas's research is about people's responses to vaccine in Malang and in Aceh. So thank you, Dimas, for your contribution. So that ends our Q&A session, and we thank everyone. And then I would like to have some takeaways from your presentation, Dr. Ali. The first one, I think religious institutions can play important role in addressing the impacts of COVID-19 in the community level. I mean, it happens in Indonesia, so I assume that it can be generalizable. It is generalizable in other contexts with different geopolitical domains, social cultural realms, like here in the US. Even some churches in the South, they also have a say in mitigating this pandemic. And then my second takeaway would be religious institutions can become or should become a government's partner in providing the right narratives about COVID-19 and its vaccine to their respective congregations or respective members. So with that, we end this Q&A with this presentation. I'm handing this over to our MC, Ibu Pauli. Thank you, everyone.
Thank you very much, everyone, for joining us in our very engaging discussion. Please allow please join me in thanking Dr. Muhammad Ali for his excellent and important presentation. I am sure I can speak for all the attendees here that we have learned a lot from this talk. We hope that you will be joining us again in our future speaker series. And we really appreciate your support. Thank you again, and have a great rest of the day and stay healthy. Bye-bye.
Thank you. Bye.
Thank you so much. Thank you. Thank you for having me.
Thank you, Pak Ali.
Thank you so much.
My
It was
pleasure.
it was so enlightening.
So we may leave now, or are we still there? Okay. All right.
Terima kasih, terima kasih.
Sama-sama semua yang hadir, terima kasih.
Yeah. So thank you, Indonesian Consulate General in San Francisco, and then University of Washington, Asian Literature and Language, Southeast Asia Center. So thank you for forcing me to be the moderator. So what do you think? What's the next plan?
I think we can stop the recording.
Is it still recording? Rin? You're muted. Bu Nur, you stop recording, right?